In this video, I want to talk to you about golfer's elbow, what it actually is, maybe what's a better name for it, but most importantly, the 4 things that you can be doing to get rid of this very frustrating condition. So let's go. Thanks for checking out the channel. My name's John, head therapist at John W Sports Injury. Now, if you haven't subscribed to our channel, why not? Because we want to do 3 simple things. We want to be helping you to understand your body so you can be getting rid of your pain, so ultimately to be achieving those sports, exercise, and all-round well-being goals. Does this sound like some stuff that you want to be seeing more of? Make sure you subscribe, hit that bell notification, and I'm going to keep you updated when we bring out more tips just like this video. But we want to talk today about golfer's elbow, or actually probably better termed or anatomically termed medial epicondylitis. So what is this? Well, it's a pain on the inside of our elbow. Does it just affect golfers? Absolutely not. In fact, the more common people that we see more commonly seen people in the condition in clinic would not be golfers, but it's typical for anybody who may be using the wrist joint excessively or gripping on objects excessively. So actually, whilst the pain manifests itself in the elbow, the problem is often at the wrist or perhaps even at the shoulder joint. So the way you can kind of demonstrate this, if you're somebody that's feeling that pain on the inside of your elbow, I'd encourage you to find what we call your medial epicondyle, which is a little bony point on the inside of the elbow. So if you feel your elbow joint come slightly inside, slightly down, you'll start to feel a bony prominence. Now, if you start to grip your hand, you might start to feel those muscles and actually that tendon just being loaded, which is then attaching onto that bony point. Now, the muscles that are working as we grip are these muscles on the top here, what we call our wrist flexors. So they're bringing this wrist into flexion. So when we're doing this, it's creating like a pulley effect onto that elbow. So if we get some dysfunction in these muscles, they then pull at that elbow and create that dysfunction. So that's what golfer's elbow actually is. We term it golfer's elbow because there is a lot of wrist movement in golf. But as I say, these could quite commonly affect people who are typing, people who are painting, people who are using tools like screwdrivers, anything like that, where we're using these muscles can really cause that pain in the elbow. But more importantly, if this is something that you're suffering with, I want to talk about the 4 things that you need to be addressing to make sure that this goes away. Firstly is stretching. Now, we mentioned that the problem comes about because of a dysfunction in these muscles, these flexor muscles here. If we're using them too much, they can become tight and then they can pull on that elbow. So in order to stretch it, we want to pull these in the other direction. So what we're looking to do here is to get our arm into a straight position and pull those fingers down. So effectively, we're taking that wrist into more of an extended position and opening up that joint. We want to be holding this for about 30 seconds. We can also do this stretch by placing our hand up against a wall and again, keeping that elbow straight and that wrist into extension. You'll notice that my fingers want to be pointing downwards to really get the benefits out of that stretch. And you should be feeling that pulling through this area. Hold that for 30 seconds, repeat a couple of times a day. And what you should be finding is that it starts to loosen out that area, which will have a positive effect on that elbow. Our second point, what we might like to do here is something like rolling or self-massage. And this is one where in particular, I feel like self-massage using what I term a pin and stretch technique can be really beneficial. How do we do this? Well, what we look to do is use something like our other hand or a knuckle or even an elbow to work into some of those sore areas. What we're looking for is those painful spots or what we might term trigger points, bumps, knots, lumps in that tissue that might be having a negative effect on the point where they're attached. So as we move around this area and we gravitate through this area, look for those sore points. If we find a sore point, the first part is to do what we call a pin, which is simply to lock onto that area. Apply that pressure, it will initially hurt. Then after a few seconds, up to about 30 seconds to a minute, you'll start to feel a numbing effect or it desensitized. This is the point where we then start to stretch that tissue. So we lock onto that pin and then we just start to bring that wrist down. And again, we can repeat this 5 to 10 times. So we're pinning, then we're stretching. And by this, what we're looking to do is elongate those fibers under the pressure of your hand to start to break down that dysfunction or those adhesions in the muscle tissue. Now, we can look to repeat this for about 2 to 5 minutes, and we want to probably give ourselves a day off in between treatments to allow that to recover and start that repair process. But it's something that we can spend 2 to 5 minutes doing on that problematic wrist flexor area. I'd also recommend applying some type of lotion like an oil, moisturizer or cream, just so that you can move through that tissue nice and smoothly, and you'll get better with this technique in practice, and also your pain sensitivity will die down and allow you to work deeper into that tissue. The third thing we want to be doing is we want to be strengthening up that area. One thing we do know about these tendon issues, so golfer's elbow, where the tendon of the muscle attaches into this medial epicondyle, is that we want to start to load that tension, and we want to sort of progress how much load we put through that. So in order to do that, you can use something like a water bottle. And one of the advantages that I find when I'm working with clinic of a water bottle is we can start with this being empty, and then we can increase the weight by simply filling it with water. But the movements that we want to do is start now to encourage some wrist flexion. Now, we can start initially by doing this with the arm supported. So you can place your arm over something, the edge of something like a table. If you imagine the table being here, that then does is take the weight of my arm, and then the movement comes through my wrist. Okay, and again, what we're looking to do here is about 12 repetitions of this movement. If that becomes difficult, we know that that's too hard, and that's where we can either, if we've got water in the bottle, we've got too much weight in the bottle. But if that becomes easy after 3 sets, that's where we can look to firstly increase the weight by adding water. If that then becomes easy for you and isn't creating that pain in the elbow or a pain the day after exercise, you can start to add the water, and that will then increase the weight. We also can look to change the directions that we're doing these movements in. So the first one is what we call the sagittal plane movement, moving up and down, and then we can also incorporate rotation at the area, going through what we call pronation and supination. Firstly, we can do this supported. Once you feel comfortable, you can do both those movements without aggravating your pain. We can then come away from the table, the desk, anything we're using to support us, and we can be looking to do that movement, both flexion and extension, pronation and supination, unsupported. And here what we're doing is adding load to that area. So when you move away from it being a supported exercise, you might want to take the water out of the bottle and begin that process of slowly progressing through how much load you're putting through the area. But what we will be doing then is strengthening the tendon and ultimately long-term resolving the problems caused by golfer's elbow. And so that moves us on to my final tip. And this is sometimes the easiest to make a significant difference, but most commonly overlooked. And this is to really think about the cause. So this could be multiple things. For example, if you're a tennis player who's developed golfer's elbow, this may have come about because we're gripping too hard on the racket. So by simply adding a second or further over grip to the racket, this will reduce the amount of tension that we're putting through the forearm and ultimately create less force at the elbow. If you're somebody who works with tools and this has been created by using those tools, there may well be tools that are adapted in order to help with this condition, or perhaps even a support might be a benefit when you're at work. I'm not someone who believes in the long-term use of support, but if we know that work is the aggravating factor, whilst you get over this condition and go through the 3 previous steps, something like a support may be really helpful. Or again, just simply thinking about what might have caused it and how you can make a change, which ultimately means that you grip less, so therefore create less force pulling onto that elbow. I hope that makes sense. It's a very, very common condition. And just because we often term it golfer's elbow, it doesn't have to be sport related. It can be so many factors. But you want to be adopting these four key principles of stretching, self-massage or rolling work, strengthening, and making sure that you're correcting the cause in order that you can fully restore normal function. Has that been helpful for you? If it has, make sure you smash that like button, because this lets me know it's the type of videos that you want to be seeing. And I'm going to link to the video here where I talk about tennis elbow, because the two conditions are often very interrelated. And I'll see you on the next one.